Okay, looks like we're recording. So the purpose of this this discussion is to talk about order sets, which is something that eClinical's had present since we've installed eClinical, but it's not one that we've used much. Some of you might be familiar with it a little bit. The concept of an order set is that it's a menu, and usually it's a diagnosis-driven menu, but there's a couple other ways you can do it. So I set up these 4 patients that we'll just go over a couple of simple ways to use order sets, and then if you have some questions, we can kind of hit them as we go along, or some I might say let's hang on to the end. These are all fake patients. And I'm going to do a couple of examples of chronic disease, and then one for a physical exam, and then one for just a sick visit. In this case, I'm seeing one of the X-men, and he has hypertension, just because I thought he probably would. And I'm going to use an order set, in this case, for hypertension for Wolverine. There's a couple ways you can do it. The first way, I've already diagnosed Wolverine with hypertension. That might be one that I just searched for like we normally do. It might be one on his problem set, which he has along with monkeypox, it would appear. The key on order sets is, generally speaking, make your diagnosis or your diagnoses first. I'll show you why. I'm going to give him a second one as well, which is monkeypox, which I'm quite sure we don't have an order set for. To get to order sets, there's 2 main ways. One way is the treatment window, and there's this button which, unless you've looked, you've probably never paid attention to. It's OS for order sets. Normally it's gray, so any other window that you have open, it's gray. When you're in treatment, though, it pops up and it turns red. Like most other things, I've got my multiple tabs here for my multiple diagnoses, and it will open an order set based on which tab I have highlighted, if there's an order set for it. If not, it will open to default one, and I'll show you that. So on hypertension, I'm going to click the order set, and it's going to pop up basically this big menu. And this is one that mostly that I built. eClinical came with a number of order sets, but they were woefully incomplete, and I don't know who built them, but they needed a lot of work. So in this example, you can see it all starts with medications, and notice I've got my tabs here just like on the treatment screen, so I can tab back and forth. And when I built this one, which may need a little updating, I've got a lot of the common medications in this case for hypertension. One limitation is I can only have 1 dose per med. I've tried putting in 4 lisinopril doses. Every time I put in the next one, it just overwrote the old one. So I can only have one strength. That's a limitation, so you'll have to go back if you want a different dose and change it after the fact.
Are you going to go over how you create the initial order set?
I can show you how to create order sets. One of the thoughts is that's a permission that they don't have turned on for everyone, because the order sets are global and available for everyone, although we're having an eClinical meeting on Thursday where we're discussing working up a policy for which physicians should get access to order sets and other customization, because if people are enthusiastic and want to build them, we want to use their enthusiasm, but we want them to do it right.
So we have to use order sets that are already present?
Right now you have to use order sets that are already present, but we can add them.
We can add it, what's up there, or not?
We can build more order sets. There's no limit on the number of order sets you can build or what you can put in them.
I mean, the main reason I'm here is I want to build an order set for LFTs, and
Okay,
there's not a very good one.
There isn't right now. And you actually, as Dr. Elsner, you already have permission to do it, because we've had you make some other stuff before. There are other doctors, most don't want to and don't care about wanting to mess with it, but the few that do, we want to get them a little bit more training to show them how to do it. And that was a long answer to say yes.
So through him. Okay.
Yeah.
Okay.
I mean, I don't know that I'd want the entire internal medicine department making them, but if we had 1 or 2 internal medicines who were enthusiastic about it and had a consensus from the department and could do it right, that'd be great. To scroll down, in this case I've got some labs ordered, and these are just 3 that I picked. There's probably more that you'd want for your standard hypertension. Notice in this case there's this little H here. Now this particular patient's a fake patient, but this actually shows this H is historical, so that means there are some labs available that have been done in the past on this patient. So I might be coming here to say, I want to order their BMP. Oh, I'll click on here. I see one's been done before, and It'll show me the date. And there, I can skim over and see the result if I really want to, and I might see that, oh, that was just barely done. Never mind, I'm not going to order it. Oh, it was last October. Yeah, I'm definitely going to order it. So when you see the little H, you'll see these all over in eClinical. It means this lab or order you're looking at has been done historically, and you can go check the result, see if you want to do it again. Similarly, diagnostic imaging, I only put echo in this one because it's hypertension, but if it was a knee order set or a shoulder or an ortho, you can have all the x-rays you want in there. A couple of EKGs, depending on if you're going to read it or if IM's going to read it. Don't have any for therapeutic injections, but if it was, say, a migraine order set, you could have your Toradol and Phenergan or Zofran in there. Couple of referrals. So this is a fast way to make referrals, or at least to start referrals. If you're using the menu or the order set in the exam room, you can click through the several things, and I'll do it in a moment, and then that will start the referral. It doesn't complete it, so then you can complete it later, or you can tell your MA, please finish the referral to Dr. Jones, and they can send it off.
If you click on it, does it lead you to that screen to complete it?
It doesn't here. It will drop it on the note, which I'll show you in a second.
No.
There are follow-ups. These are just ones that I picked for hypertension. There's some other ones available like PRN in 2 to 3 days and 1 year for the annual exam. Some of these, the education, the physician education, these are ones I put on there. I just stole IHC's care process model, so you could actually click on the PDF, open up the care process model. If you want to review the 30 pages of it, you can do it right there. I'll show you a better example in a minute where you can search all the USPSTF screening recommendations. More important, and this carries over to meaningful use as well, one of meaningful use's requirements is that we provide education to at least 10% of our patients. Now I know we educate more than 10% of our patients anyway, but eClinical has to have a way of knowing that we did that. These are 3 that I picked. Ultimately, and Marla and I have talked about this, we would like to have Grainger logo, Grainger branded education, so when we print it out, that it looks like it's coming from us.
So
Finally,
if you click on those, are you going to get 5 pages of education?
if I click on these, yes,
Dash
I
is
will.
only 1 page.
And it depends, but I'll show you one.
The dash study.
Oh.
Right.
And then the web reference, I've only got one on here. I have more on some other ones I'll show you. For you to get credit,
Not the dash, it's the dash study. I get something.
for you to get credit on meaningful use,
1 page.
you can either get it straight off the PDFs or a web reference. So if you have the whatever website you love to send people to, you can get credit just by doing that. So on this patient for Wolverine, let's do it real quick. I'm going to put him on lisinopril, 10 milligrams. And I wrote these all with 30-day ones. I tried to do a 30-day and a 90-day. Again, it won't let me. It'll let me put 1 lisinopril in there. So I picked that one. If all the PCPs said we'd really rather it be 90 days and 3 refills, I'll change the order set. So I'm going to give him some lisinopril and some spironolactone to see if we can really mess up his potassium. And I'm going to do a BMP and order an echo and an EKG.
Where some of it, like the labs, are not highlighted.
Mm-hmm.
Is there a reason for that?
Those are just gray.
Is there a reason why?
Yeah, because they've historically been done.
Oh.
That's all that it means. You can still order them though. They're not inactivated or invalidated. I'm not going to give him a shot, but I do want to see him back in 4 weeks, and I'm going to send him to cardiology. And on the PDFs, there's a couple ways of doing it. Let's say I have the DASH diet handout in my room that I give to patients all the time. In that case, I can just click the PDF, click that, and when I order it, eClinical is going to record that I gave it. Let's suppose instead that I don't have it in the room, I just want to print it on the fly. To answer Deb's question, I'm going to click on the little PDF icon. This is a little bit of a clunky process. I don't quite like how they did this, but I click on it and it's going to open up, and then I can print it. And this is just a PDF capture that I stole from Mayo Clinic. So I could print it and close. Now in this case, I wish that if I'd printed it, eClinical would automatically know that I gave education, but it doesn't. It still makes you check the button. It's 1 extra click. I wish it would click it on its own, but it doesn't. And I referred them to the GraingerMedical.com website, which is limited on information. Other order sets, I have more stuff in there.
What about
What does that do again, the web reference?
I'll show you.
What about like up to date, since like we can catch into IHC and we all use it, how can we populate that?
For up-to-date to show, so if you're providing patient education through up-to-date, whether it's through IHC or others, eClinical still doesn't know that you did it unless you have it in the patient education and you click it and you order it.
And that's where you told us we have to give things to you to scan in, is that
Yeah,
the
there are
email
some
we got?
things like handouts I have, is there a way to get that into the patient
Yeah,
education?
supposed
Got a
to
ton of
be-
Well, you know,
Yes, so
I'd be happy to help, whenever you've done Jackson, what we
Yeah,
can do that.
Marla and I have done a few on them, so if you have
That's on my
documents
desk,
already,
I have
whether they're paper,
I'll give them, and I'll scan them. Convert it to
paper so we can
PDF.
scan them, or preferably if you have them as a PDF or a Word doc or anything electronic, they don't have to be, but if you can, then we can convert it and make it look nicer. We can put them in as scans. It's just sometimes when you get a copy of a copy of a copy, it starts looking a little rough. The other key point on this is notice there are these blue order buttons all over the place. All of these are individual orders, so I might have checked something in every category, but if I click this order, it's only going to order that appointment. If I want to order everything, and again, I don't quite like how they laid this out, but it's how it is. When I've done them all, click the order up at the top. That's kind of the global master order. So I'm going to order that.
You have to select all, just click highlights.
Yeah, just click the boxes of all the stuff you want to order, and then click the order at the top. If you train your muscle memory to do that, then you'll always order everything. Otherwise, if you just click the one order, I might have selected many areas, but I'm only going to order the medications if I click that one. I'm going to close that just so you can show what it did. And now it's done a number of things. There's my lisinopril, spironolactone, there's the BNP order, the echo, the EKG, and the referral to cardiology. Now the referral's not complete yet. Notice there's not a reason in there. So here's where you, or your MA, is tell them please send them upstairs to see Haas. They can click on it. Now it opens the window. Now I can go put my specific cardiologist if I care. It's always assigned to me, the person who did it, so that's going to have to get reassigned to the ref, whoever. Add the description, add the notes like you normally do for a referral, and send it off.
Do you have to put the provider in if you're assigning it to like I'll send referrals to Tim?
You have to put him in.
But I do I have to assign to at the bottom? I can just assign it to Jesus
So-
without putting his name at the top.
On referrals, in this box right here, you have to assign one or the other. Now, if I know that I want to see Tim Hollingshead, I usually go click on here, and then I go search for Tim,
Right.
and I put him in there. If I'm sending them to pain, and I don't care if Davis or Burns sees him, whichever one, I usually put in pain. Now I might write down in the notes whichever one of them can get him in first. If I want him to see Davis, because he saw them 3 years ago, then I'm going to put Davis in. If I put Davis in there, it will automatically fill in his specialty. If you don't care, like now if we have,
Stuff trying to search for it.
yeah, it is faster to put the specialty in, because you can just start typing CARD and it'll go right in.
So I have a question, are the advanced practice clinicians still supposed to put the referrals under their attendings so that the attending gets credit because they don't track us?
I don't know how they're tracking referrals for you guys.
Tanner told me to keep it under Olsner until they changed it.
If that's the case, if they've told you to do that, I'd keep doing it that way. I don't know that they've changed anything. Nothing that I have heard on that one. So that one's how you'd quickly, you go in and you or your MA or whoever you want to do it, finish the referral and send it off. Notice on this case, I did click the button for the DASH diet and the web address. So those where it said the patient was educated with the DASH diet, and there's the little name of it, the whatever.pdf. And then I wish it made a new line, but it doesn't. Formatting stuff. Educated with the GrangerMedical.com website, and there's the actual web address.
So you should click for everybody, right?
You could.
Everybody's getting to go into the portal.
Well, in the ideal situation, is any of the PDFs that you have, you're regularly using for the patient, you
should be
have
on
on
the
your
portal.
web landing page under an education piece.
It's a
Yes.
web landing page.
You should be able to pick them up on there, and I don't think that's been done enough, but we need to work on getting those all on there.
Like the
What's a web?
colonoscopy
Like,
preps are on
like
there.
your colonoscopy preps and all
Yes.
those kind of things, if they're on there, then that's where you can be referred to.
Where do we document education if we're not using a website? If we're not using the order set? Where does it pop up as an option?
So what kind of education, for
So again,
example?
if you wanna send somebody to a website,
Just to be able to select that without having an
where
order
do you
set.
select
The
the educational material thing if you're not using an order set?
I don't know that eClinical has a great way
So
of
it's gotta come
doing
through an
that.
order set at this point.
Right. Because
Most of them aren't order sets.
So most of them aren't order sets, we need to be able to click
Most of
some,
them aren't
I
order
verbally
sets,
put
yeah.
in, that it's done, but it's not getting credit, obviously.
if you're just typing in there, I sent them to the diabetes.org website or whatever, you're right. You're not getting credit for it right now because it doesn't read, I know, it doesn't read the free text. It doesn't know what you wrote in there.
Maybe we could create an order set that said handout, and you could click handout given.
One of these things, right, about one of those, like outgoing referral e-clinic sends, there's not one of.
That's what I was kinda asking, so
There's
there's no
something there.
other spot, like many things, there's 8 ways to get to something, there's not, it's only through the order set that the education can get documented?
That's the easiest and let me say the free way to get credit for education. I know. The other one is this button, education. That one does a couple of things. RX Education will let you, if I prescribed lisinopril, it'll bring up information on lisinopril and spironolactone. If I print those, and I get credit there. RX Reference, we don't have turned on right now because it costs money. We can get patient education either through Adam or Crames or HealthWise, which are 3 commercial patient education. I know Marla's used at least one of them across the street. That one I think will be up for discussion, and soon. It's $7 per provider per month, but it's all or none. You can't just turn it on for you and not for you. So it's,
Can't you go to
What was that,
What's the
custom?
custom? Yeah, what's the custom?
What was that
the custom one, and there's some debate on this, and the custom is just I can go to something on my local website and give this handout. But I've received conflicting information on if that counts. If that counts as, if you get credit for education on that one or not. I've read both yes and no, so I don't want to tell people to do that yet and have it be no. Now when they do turn on the education, if we decide to pay eClinical for it, another button pops up here that says Crames or HealthWise or whatever, and they're all quite good. They're very similar. You can go search for whatever you want, print out as much as you like.
Can't you have a miscellaneous?
So is it a patient
order
version
set?
of up-to-date, is that what it is?
Kind of.
Something for
I
them?
mean, they've taken their own information and curated it and made it their own, but effectively it's like the basics and beyond the basics of up-to-date patient ed.
Up-to-date's paid for, I mean, for a lot of us.
Yeah.
Well, but if you have about 20 standard handouts that you really like, then we go ahead and put them there, and they've got your name and logo on the top and your phone number, contact information on the
Is that
handout.
a copyright problem, that we're using stuff out of up-to-date and then you're sticking Granger on the top of it?
Well,
That seems a question.
I haven't stuck Granger on the top of any up-to-date. I've got some up-to-date beyond the basics in some of these.
I'm in the SNAP
I mean, your own handout.
order set, which is absolutely screwy, but how do I put ultrasound in?
I think many of us are making our own handouts.
You can't do it there.
You go back to the order
Up-to-date's
set.
too good.
Yes.
If it's not on here, you have to
So
do
where it
another
says
one.
browse.
We'll have options. Fatty liver.
Like sometimes I have a couple order sets that
You
are
have to
very
add
good,
them.
and I'll look
Give
at
them that
stuff.
admin side.
And that's what the browse is for, right?
You mean if you want to get to a different order set, what the browse is for?
No, that's what I'm asking, isn't browse to look for other stuff that's not in the order, that's not in the order set? Or is that to add stuff to your order set?
It's usually not to add stuff to the order set template. But I
Just
think
to
this
look
is
for
where
other
you
stuff.
could add one kind of a one-off or on the fly that I want to put them on Philodipine, which I don't have on here. Then you could do it with the browse there. But it would not add Philodipine to the order set itself that you build on the back end in an administration section.
Click on others.
Right here?
Yes, will that bring you to, go down into the patient education, will that bring you to the Granger website?
So right now, on all of the order sets, I have stuck on here grangermedical.com. In this case, let me go back here to hypertension for a moment.
So you could use that could be a way to get to it.
You can, and that's why I stuck it on everything. So notice again, this hypertension one is linked to the hypertension diagnosis. Let's go over to monkeypox or others, which has no order set associated with it. When I click there, it's just going to go to the first one on top. I made the first one on top intentionally named AAA Education to make it float to the top. There's nothing in that order set. I just put it there as a default, except you can click one of these, and if I'm pediatrics or family, I couldn't find a great website for internal medicine. The ACP doesn't have a good one. I wasn't trying to discriminate against you guys.
Oh, God forbid.
But I'm family practice. I might say go check out thefamilydoctor.org or the CDC or wherever I like, and this can be added to whatever. So if there's not an order set associated with a diagnosis, it will always jump to that one. And if you just want to grab credit and just get it and be done, you click web reference, you order it, then you're done. You just got credit.
Again, isn't every patient is pretty much told to use, given access to the web, so that you're
Encouraged to,
encouraged, every patient you can click that on.
encouraged to.
Right.
Yeah, but half of, like,
Whether they
my
do it or not,
foreign-borns
that's up
aren't
to
hooked
them.
up.
Whether they do it or not, but I mean,
You know,
every
come on.
patient, to get the credit, every patient is automatically.
They're supposed to be web enabled. A fair number aren't. I see when I'm in their chart.
And some can't.
Oh, yeah,
Just
they don't even have a
refuse.
computer.
For
They're
kids.
not gonna do it.
Yeah, kids, Vietnamese,
But it's a 12-year-old who's looking at the website, the police station, the 12-year-old kid.
helping the
Before
adult.
Helping the adult.
Well, what he's saying is his 6-year-olds probably don't have web enabled. But then
Can't get on web enable some kids, so.
Well, we're not talking about web enabled, are we, Dr. Jackson? This is just referring them to the website.
Yeah, it
whether
doesn't
or not
matter.
This is just
whether
referring.
It's just referring to get the
Enabled
credit.
Yeah.
But to get the credit,
Oh.
it's both that and the patient education, or is that the same?
Those are different meaningful use measures. The
Referral to the web and the patient education.
Yeah, so patient portal and having stuff electronically accessible on a patient portal is a different meaningful use measure than the education one. So this is mostly hitting education.
But this is 10%.
But
This one is
referring
10%.
them to the website counts just like handing them a handout counts.
Yes. If
Which is patient education.
it counts, if you went through this
have to.
process, because it's the only way that eClinical knows that you told them that.
Wait, so say that again, so that if you click to have them go to the web, even though you don't give them a handout, that
Yeah.
counts as patient education?
That counts as patient education.
So either way it does.
Yes.
Doesn't matter if you get them like.
I mean, you
a
could-
that
So
and
hey,
say, here's my
you get
handout.
10% of them.
Yeah.
Because you could click on every single
Yeah.
one.
Yeah.
But then you hand them out like a diabetic menu or something that I have tons of, and say, here's your, which we do every day anyway.
Right, we're all doing educating way more than 10%. It's just letting
Is that a
eClinical
new
know I
measure?
did it. It's newer.
New require.
I think that was in stage 2 of meaningful use. I'm planning to do another one of these on meaningful use. I'm just not yet because Medicare for about 3 months earlier this year took comments on modifying stage 2. And the comment period was over in June, and they're supposed to rule any day now, whatever that means in the
It's like
government.
the Supreme Court, you just wait.
Yeah, you just wait, for white smoke to come out, and then it,
That's the Vatican.
yeah, I know, and wait for
They're
it to
like
come out.
that.
So some of the meaningful use stuff, and the proposed changes are actually better and simplified it significantly, so it will be good, and the betting money is that they will sign off on it, but they haven't yet. Having said that, the changes on education don't change. It's still 10%, even if they buy off on the new ones as well. This would be where I prescribed in the lisinopril, but if I want a different dose, then I have to go click into it, make the different dose. It's basically just a way of getting things on there fast. So that's one way. I'm going to jump to another patient, another guy with high cholesterol.
Are a lot of folks using order sets now, or is this still sort of?
No, not much. We're rolling them out for a number of reasons. Meaningful use education actually being one of the higher reasons, because it's one of the ways you can get credit fast. And I've suggested to people, pick 1 or 2 of your popular diagnoses and just make sure you do the order set process here for those 1 or 2. If I just did it for strep and bronchitis and URI and UTI, I'm way over 10%. And I tried it last quarter just for fun, and I'm at about 40%. So it's easy to hit the 10. And your MA can do it too. This is a second fake patient, and this guy, we're seeing him for cholesterol. Notice in this case, I haven't yet given an assessment of hyperlipidemia. He might have one, he might not. So I'm going to get there a different way. There's a tab over here called Order Sets. Mine doesn't open there by default. But if you click on it, you'll see that I've got a few that I have favorited. So maybe you don't want to go see. I did put education at the top of the list.
Yeah, you go straight to.
I put hyperlipidemia on there because I knew that I was going to be doing this. So I'm going to click on there, and here it'll give you 2 options. One, it'll give you the problem list. So in this case, fake guy already has hyperlipidemia. I can click on it and hit OK. Before I do that, a lot, but not all the order sets are linked to a fair number. So let's suppose I've never diagnosed this guy with hyperlipidemia, but I am now. I could click it right here as well. Now, this illustrates the point that making sure that we're reasonably managing our problem lists. If you've got 400 on there and 8 instances of hypertension, it's going to drive you crazy because you'll have to scroll through this long list. So, you know, take the sinusitis off of there. So I'm going to click on his hyperlipidemia and I'm going to hit OK. And it's going to open the order set. Notice,
Were you able to delete one of the problem lists just there?
I can't delete the problem list straight off
Not
of
problem list, but one of the problem
an item from it.
Yeah. Did
No.
you see you do that? Okay, I thought you did.
No, I didn't. To delete something off the problem list, and we'll jump over for a sec. When I'm on here on it, then I would click on the ellipsis, then I can delete it from there. It's more just to illustrate, you know, manage your problem list the best as you can. A little bit hard if they're seeing lots of specialists, but you try. So I'm going to go back. My hyperlipidemia, he's already been diagnosed, so I'm just going to say, yep.
That's ICD-9.
This is ICD-9. ICD-10 is going to do this too. It's probably going to make a longer list. Now, notice on here, I just picked hyperlipidemia. There's no tabs up here yet because I didn't have any assigned yet. But I'm going to go ahead and put this guy on some Lipitor and some Well-Call. Why not? We'll spend a lot of money for him.
Didn't you make the favorites by the star on the right? Just
Yes.
Make this a favorite.
Yes. So, to make this a favorite, eClinical loves their stars. Wherever you see a star, generally you can click on it to make it a favorite. If I hover over this, it says remove from my favorites. That implies that it's already on my favorites. Most of the time you'll come in and this little X will be green instead, and it'll say add to my favorites. And that's how it shows up on the right chart panel, so you can access it faster. So I'm just going to order Lipitor real quick. I'm not going to order anything else on this guy. Well, except that I'm going to give him this web reference from the CDC about high cholesterol. And I can go look up IHC's care process model if I want as well. Again, I'm going to click the order at the top, because if I only click this one, it won't order my Lipitor. It'll only order that. So just always click the top order.
But if you're doing just your patient education.
Yeah. Now, notice that I didn't add this. It added the hyperlipidemia, and then it ordered all the stuff underneath it.
You don't want to have to do each one.
So you can either add the assessment first, or you can go click on your favorite and add one. Now sometimes it may not have the linked assessment. Maybe they've got some, maybe you're doing it because of diabetes. I didn't link all the diabetes because there are dozens of them, and it's going to get worse with ICD-10, so I didn't link them all. That might be the case where it's faster to go search for the assessment, put it in, and then go hit the order set.
Can you put can you switch those bars in order set versus the template? Because you're gonna have to scroll over.
Can you set or change the?
Yeah, or it's overview.
He's asking
Can I change the order of those so that I had order set as number 2 or number 1? Most leftward? I don't think so. I think it's fairly hard set which ones there are. Now you can
See, your order sets are now in.
It's always been there.
It's always been
I'm
there.
just
Now,
looking.
in your
We just never used it.
In
You know, the
the-
DRTL and history and CD, I don't personally ever use that. I always use the temp.
so you can control what you see on here. You can hide some of them in the My Settings, in everyone's own My Settings. You can hide the ones you don't want to see. I've got all mine turned on to show all them. And you're right, it scrolls over.
Is that how Internal Med does it?
Which one?
Gandolfi asked us, the DRTL.
DRTLs for labs, like, I like that for a diabetic, like.
Oh.
3
Yeah,
months
this is
ago,
for
my CMP, so I know what. it
documents and
was.
referrals
It
and
goes through
something
all
in
the
labs.
documents,
I use that.
labs.
Telephone
Yeah, so that it
Telephone
doesn't
actions.
actually-
Yep, I do
Yeah.
that,
So
okay.
I
Like
always have to
PCM
scroll
now
over.
is
I'm
my
trying to see how do I.
Transitional care management.
Oh.
I put the documents in that tab.
Okay.
Usually when I'm trying to do real work, I hide a couple of these because I don't like to scroll it for exactly the reasons Craig just said. Now practically, I always have mine open to templates by default, so I don't care that templates is clear off to the side because mine always opens there. But I usually turn a couple off. I had them all turned on for today.
See, for us, we have so many diagnostic codes that his pet peeve was how to make it.
Yeah.
Which one's first, which one's, the
Okay.
newest one's.
Let me,
always
I'm gonna jump over, and in the interest of time, I guess we're not too bad, and do one on an annual exam. I picked a Medicare one, but a similar process could work for adult annuals or well children, well child visits. This is a 55-year-old, but we're gonna pretend that he's Medicare. He or she's Medicare. In this case, again, I may have already pulled in my Medicare annual wellness visit template, and if so, then the V70.0 assessment's already there. Or I favorited this one. And again, it pulls up all this person's medical problems, and it's also got linked V70.0. So if I haven't added it already, I could add it there. If it's some of the IM patients always have V70.0 on their problem list because some of the providers like having them there. So however you get it on there, I'm going to click OK. Bring up the same order set. I've built these thus far under this Prev for preventive. Now again, let's suppose I'm in here and then I decide, there's some stuff on the diabetes order set that I also want to use. Okay, that's fine. You can still scroll up and down to whatever ones you want and pick other ones. Still under the assessment you're using. Now this one, on the Medicare annual wellness visit, the stuff I put on there were the things exactly that CMS says they will cover as screening, which is why there's no prescriptions in there and there's no labs in there. But there are some vaccines and some other things that they will do. Some of the, they have you do the various screening for depression and other things. Now the one in here, so all the rest of this looks the same. I think I may have stolen this from, this might be Marla's actually. And then these are some others, so I could print the web reference for the patient so they can go look up what does Medicare cover. Right there, we're bigger. Yeah.
Well, some of them actually are pretty savvy now.
I can go look up as well from CMS or from the AMA. They're both similar forms, just look a little different, and actually see what is actually covered, because I can't remember all that. And I could print it off or I can read it, and it's got
Which one of them, right?
it's got the codes so you can bill it. Along with that, I put this web reference in, and this one's for us. If you click on it, this one pops up a little window, and I can actually put in here, if you want. You don't have to use it as a 65-year-old smoker. And it will give you all the A, B, C, D, I recommendations for this 65-year-old male smoker. The stuff recommended to do and not do. You can look at it if you want. And again, I'm just going to put in their diet and exercise, and I'm going to tell them to go check out whatever Medicare covers.
How do you see what's there in patient education? What's available to give patients?
Like, you'd have to look, to see what's available in there right now, you'd have to look on each order set and open it up.
I mean, you can't, there's not a spot just to see, okay, what's available for patient education I can put, or I can use to get to the patient. Is there a way to do that very easily?
There's not one page that you can look at and see there's all this education in all of the order sets. You'd have to look on a per order set. Now, as far as what you can put in there, the sky's the limit. I mean, anything that we can get in there as a PDF, whether it's scanned or converted from Word, they can stick anything in there.
Instead of creating it new, I'm just wondering
So you see what's out there that even everybody else has created to see if you want to
what's
stick those
already
into
on
your
the
order
system
sets.
that's available that I can add to. Is
Like
there
that
a way-
one we did on antibiotics and probiotics, that kind of thing, be able to find that.
Oh, there's a
I didn't
probiotic
remember-
one?
I didn't remember what I created. I remember
Well,
creating
you
it.
help me come up with that one.
But again, I don't remember that. Is there a way to seal that stuff?
Well, when you say that you created it, where is it now?
I don't know. That's what I'm saying.
Well, unless
It
you,
must be in the system somewhere. I don't remember what that sort of thing. That's what I'm asking. Is there a way to, for anybody to say, okay, let me see what's out there, then I want to use that. Is there an easily accessible way to do that?
the only way, as far as education available in an order set right now, the only way I could see is to go to that particular order set and look at it.
But there is,
But there must be
there's no,
Master list.
there
There's
must
no
be, yeah, I'm
master
saying
list.
a master list that you
Not,
can add to that.
not
order
real,
set.
that you can scroll through,
Is
not
there a way
really.
to?
If there is one, I don't know where it is. I have not seen one. Sorry. The last one I was going to do a sick visit real quick. this is someone for, let's say, strep throat and or URI. So in this case, I'm using my template to give them strep, or to at least diagnose it as strep. And then it's going to ask why. All right, strep throat. So pretty much the same. In this case, I picked for strep because that's where I work. I picked the antibiotics which are most likely. Again, I'm kind of limited because I can only have one diagnosis. I can have adult or kid doses. I can't have them both. I quickly order my labs, x-rays if I wanted. I can give them a shot of Icillin when I want to see them, refer them to whoever I want. Now here's some that I took. Like this is, I think this is a Beyond the Basics on strep throat that I took from Up to Date. And Up to Date will let us do that. I think if we Granger branded it and copied and pasted straight off of there, then I think they would have a little bit of an issue on that. And then there's a couple from the AAP. I give this one out a lot for the people who have a negative strep. Let me give one other example. I'm going to jump over to one of Mike Hinckley's, I don't remember what I called it, patient education. This is one that Marla and I built with some of Hinckley's information. So I don't have any of his meds or anything in there, but there's a bunch of Hinckley's PDFs, including a bunch of his post-op stuff. And then in his case, I didn't put GrangerMedical.com, I put Hinckley Derm, which we host, and does have a whole bunch of derm patient information. So that one probably really is a good one. He could click that on every one of his patients and be totally in the letter and spirit of the law there. So the way eClinical has it in mind is that an order set is diagnosis driven, which is fine. Having said that, some of the specialists say, look, I see on average, I have my top 10 diagnoses that are 90% of what I see. Can I have my own order set? Which they can. We made one for, I think this is Dean Walker. Yep, I made this for Dean. Dean told me, look, I have like 6 or 8 meds that I prescribe 90% of the time. And I have a few labs, my pre-op, pre-surgical labs, and I think I took his x-rays off of there because he had too many, but he might do an EKG, and then those are his joint injections. So he uses these for all sorts of things. These are some patient education. Looks like I stole most of these from Up to Date. So in this case, he might use that, and I didn't link it to a bunch of diagnoses because Dean might have 45 different osteoarthritis diagnoses, but he could use this for any of them. So if you have my standard, 5 to 10 things that I see most of the time, and my standard drugs that I prescribe most of the time, labs orders, etc., having your own order set probably makes a lot of sense.
So you could get to that under just the treatment window, pull it up under whatever it's named.
Whatever it's named, and then switch it to you, or...
But how does it link to the diagnosis then? I mean, if you order something on like Dean's,
So Dean's is not linked to anything.
so doesn't it have to be linked to a diagnosis?
Yes, so the way Dean does it, Dean has done this, now he's favorited his. So let's go back and favorite it for a second. Go back and close down. Now, one irritation is on this list, it just adds them in the order you've added them. It does not do them alphabetically, so it will bother your OCD, or you can go reorder it yourself, which is what I actually did last night to reorder this, because it was bothering mine. So I'm seeing this guy for strep throat, and he says, oh yeah, my shoulder's killing me, and I gave him a rotator cuff strain, if I could spell, or type. So I gave him a rotator cuff strain, and I decide I'm going to use my order set, or I'm just going to use Dean's, because Dean has a great one. When I click on it, it looks like I did link it to several of them, actually. I'd forgotten that I had. So in this case, I actually do have some shoulder stuff, so I could link it to one of the shoulder ones. Looks like I have, that's a surgery one. But let's suppose instead that it's none of those, then I have to link it to something. This is the guy's problem list. What I told Dean is for this to show up, for him to do it that way, he needs to put rotator cuff strain on the problem list, because the order set, when you do it as a favorite, now he's got rotator cuff strain on there, and now I can do it.
So you have to either do it to a linked assessment or
linked assessment or something on the problem list. So if it's an acute problem that doesn't necessarily go on the problem list, if you want to go through it using this favorites tab, you have to put it on the problem list. So strep throat is never going to sit up here in the problem list, probably because it shouldn't be on the problem list.
And then when you do do that, then everything that you order.
So everything that I order now
Goes to that.
is gonna go here, and let's just add one real quick. We'll give them some Percocet. Why not?
And just clicking the box by the assessment
And
puts it on the
doesn't
proper
show the
list.
diagnosis on that order set.
It doesn't
You got
yet.
another problem. Let's just click the box.
You just have to remember or know that that's the one that that's the one that I got there
'Cause that's
through.
kind of some of the trouble I've had sometimes. Okay, which
Is this
diagnosis
the
was
process
that?
of getting it
Now
on
that
the
I've done
proper
it-
list, the PL?
And I ordered it. Now it's there. I ordered the Percocet under the rotator cuff strain,
Thanks.
and there it is. So that, in a nutshell, is some of the ways that order sets can work. Now let's go back to them for a second. Now, if you take a look, there's probably, I don't know how many we're at, probably around 100 or so. You can tell what I've been working on. There were about 300 initially, and we took most of them out because they were just woefully incomplete. The allergy one had cyproheptadine and Benadryl in it, and Tagamet. Well, that sounds great in 1987. So a lot of them I took out completely.
There's not a way for each touch to individually change that list.
There's not a way for everyone to change the list because it's the same list for everyone. However, for the docs who are saying, yeah, so one, you can add it as your favorite, so it shows up in the right chart panel over here. But two, for the docs who are saying, like one of the urologists said to me, look, I want to have the capability to make these for the rest of the urologists, which, great, I want to use his enthusiasm. I just want to make, when we turn on the ability for you to do that, it turns on a bunch of other customization, which is okay. You're actually already in that group. We just want them to have some training ahead of time, because anything they go deleting or altering, they've instantly altered it for everybody immediately. So yeah, so it's like some public service announcement, with great power comes great responsibility, or something corny like that. One of the pain guys, I'm not sure which one of it is in that permission group as well, so you can tell they've really gone to town and made a whole bunch of them. One of the things we're suggesting, and we'll talk about this for the people who want to do it, is when you're making one, kind of, and it's not one for you specifically, it's not the Dr. Walker one or the Dr. Olsner one, make it and give it, follow the same naming type convention. Now that sometimes gets into a little bit of an argument of who should own diabetes, because that could be endo or cards or nephrology or FM or IM. I picked endo because it came that way. Yeah. Now some of them like GI, I think this elevated LFTs, Deb and I went through making this. It was probably a year ago.
We did?
We did.
Well, now that I know some more of this, that's why
Yeah,
when we're done, I'd like you to refresh me on how to
and you've made a few, all those DO ones,
And I never use
those are
them
yours.
because they're not very good still, and I don't remember how to edit it.
I got a NAFA list for you over here.
Okay.
Dr. Jackson, you
Yes.
mentioned to me that if there's something that's where you have a lot of materials, maybe like for surgeons or something, you have pre-op materials, they may have a packet, a consent, and they may have a whole bunch of things, that can be scanned all into one huge PDF, so that they've got all of that. If you've got your guidelines for a prep, and you have other information, it may be 3 or 4 sheets, who knows, scan it as one PDF, and then all you've done is clicked on pre-op colonoscopy or whatever you want to name it, and then
Yeah.
that sits there without having to click. You've got standard groups that you're putting. Is
So
that
I've-
correct, Dr. Jackson?
Yes, so I've got an example of a few that we did for a couple of Marla's specialists. So I'll go to Aoki's pre-op. And in this one, he hasn't told me to do any labs or anything, so there aren't any in there. But these are a whole bunch of PDFs, his pre-op or post-op information. If he has a big one that has the consent and 8 different education things in them, that's where I'm going to suggest to Marla or whoever their DM is, make me one big PDF. And it might be one that they have a folder that they hand every time you go for a colonoscopy or tubes. Here's your whole packet of information. If we have that, you don't actually have to print the 30-pager off here. You could, but if you've got packets to hand out, you just click it and order it. And now, I give that to every patient, of course, and it's documented. Now I got credit, and I'll easily hit my 10% there. Plus, I'm actually doing education. I'm meeting the spirit of the law on what education is really supposed to do.
So, well, I'm gonna wait until we're done.
Okay. So so on Marla's, we've made some for her or 2 ENTs, and derm, and I think one for someone else, I can't remember.
Ophthalmology, Dr.
For,
Smith.
for Dr. Smith, yes. So, that in a nutshell is how they work or how they can work. What I'm going to suggest at this point is when you say, I see things that I like here and I have my education that I want to get in, to get it to your DMs, and he or she and I will work with, whether we can integrate it into an existing order set, if we can make a new one, and the specialist, if you say, I want my Zimmerman order set, we can make you one of those too.
Thanks, Lisa.
Okay, you're welcome.